Hi, everyone, and welcome to CCS Conversations, a ColumbiaCare video series dedicated to talking about behavioral health, raising awareness, and hopefully sharing some helpful information and resources. Today, we have a special guest with us, Dr. Todd Boire, ColumbiaCare Medical Director, and hopefully you'll talk to us a little bit about seasonal affective disorder.
Absolutely.
Welcome.
Thanks for having me.
Thanks for being here. First, what is seasonal affective disorder? What causes it?
So seasonal affective disorder is a mood disorder. We typically associate it with depression. It actually has changed from what most people think about. So in the old DSM-4, so prior to 2013, it was its own standalone diagnosis. Since then, it's a subset or modifier of major depressive disorder, bipolar 1, and bipolar 2. So basically, if we think of the depressive symptoms, you have to meet criteria for a major depressive episode or major depression, and that could be severe, it could be recurrent, could be with or without psychotic features, but also with a seasonal pattern. So most typically, onset in the fall or winter, and then it would alleviate in the spring. And what causes it? Of course, with anything where no one really knows, but it's probably related to circadian rhythm, less light, longer nights, shorter days, maybe even a little bit with temperature. So that's in essence what it is.
Thank you. How common is seasonal affective disorder?
Good question. The prevalence really varies. Most people will cite anywhere between 0.5%, 0.5%, and 3%. But that's unfair because it's more common the further north you get, presumably the further south as well, but we're in the north. So it's more common at higher latitudes. And I've seen rates as high as greater than 5%. It's more common in young people, it's more common in women. And if you have a predisposition to a major depressive episode, then it's even more common. So as high as 10 or 20% is what I'm saying. So it's quite common.
Dr. Boire, how does the holidays fall into the seasonal affective disorder? Does it have an impact?
Good question. Not only holidays, but fall in general. When people have a change in their work schedule, kids are going back to school, you might be going back to school personally. A lot of people get depressed that time of year and the holidays. If you look at the DSM criteria, though, it talks about excluding those because it's a psychosocial driver of the condition. I personally don't like looking at it that way. I think they're more related. But the DSM criteria does talk about a seasonal pattern, again, more to do with the circadian rhythm. But I think that's important to mention if you're going to see a clinician, because then maybe you might benefit from psychotherapy more than you would a medication.
Right, those things seem like they could be compounding for someone who's already experiencing.
Absolutely, compounding, good word for it, yes.
Great. What can a person do? Is there something they can do for themselves or maybe expect from their doctor to treat S.A.D?
Yeah, again, if you're going to reach out to a provider, a lot of these conditions can be treated by a primary care provider. And so whether that's MD or a DO or nurse practitioner or PA or a psychiatric provider, getting the history is critical because if it really is a seasonal onset, they might prescribe you light therapy, which is a very good intervention where you can set up in your bedroom, 20 minutes of light at a certain time of the day. There's other things that have been used, melatonin in some cases. If those do work or do not work, then you might be a candidate for an antidepressant. There's lots of choices there depending on whether you're less motivated, no energy, or you have too much energy and more anxious. And then finally, at the component like we talked about with the holidays, if there's something that's kind of related to that, you might benefit from therapy. So cognitive behavioral therapy is very effective, just so you have awareness, you know what the triggers are, you're ready for it. You can set yourself up with other coping mechanisms that might help you not only survive, but thrive during that period of time.
Great. Nice to know there's some things that can be done.
There's lots of things. There's a lot of things that can be done. And that's why I say it's so important to reach out if you're struggling, because no one should have to be miserable, and people do get miserable and it can last quite a long time. And the earlier you intervene, the better off.
So how is SAD, seasonal affective disorder, different than just I'm feeling blue in the winter, or is that what it is?
It can be, but not always. So we're talking about degrees of magnitude. So the criteria for major depression, it's, depressed mood, lack of interest in activities. You have to have one of those, and there's some other criteria like hypersomnia or insomnia, too much eating, not enough eating, weight loss, weight gain, feeling guilt, hopelessness, worthlessness, having suicidal thoughts. If you meet those criteria and you have the seasonal pattern, then you would meet criteria for major depression, with a seasonal pattern or actual, what we're talking about is SAD. If you don't meet those, and so you have a lesser, version of that, you might get fatigued in the daytime or when you get up, or you just don't feel well, but it doesn't impair your function. You can go to work, you can maintain relationships, participate in activities with your spouse or loved one, take care of your children, then you probably don't meet that criteria. But in order to really find out, you need to have an evaluation.
So if you're starting to feel that way and it's starting to impact your daily life functioning, then it's a good idea to reach out to your doctor?
Yes, and I would argue even if you're starting to feel kind of depressed, not yourself, it's really time to reach out for help, or at least to get evaluated. They're going to take a complete history and figure out or determine, if you meet the criteria or not. And then also it's a good opportunity to get evaluated for low vitamin D, anemia, hypothyroid, a lot of other conditions that can make people be depressed or contribute to depression, where you could get treated for it and it might alleviate those symptoms.
So if you're not feeling good and when in doubt, good idea just to reach out to help.
Absolutely. There's no reason anyone should be miserable.
Yeah. Absolutely. Well, thank you so much for all of that information. Of course, if you're struggling with your mental health, help is available. You're not alone. And if you're experiencing a mental health crisis, please text or dial 988. Thanks for joining us.